3.
Hi, everyone. We are presenting our poster called Racial Disparities in Systemic Disease and Cardiovascular Involvement Among Patients Presenting with Cutaneous Sarcoidosis. Sarcoidosis is a granulomatous disease with an unclear pathogenesis. We know it has a higher incidence in our Black patient population than our white patient population. And also, since skin is the second most common organ affected in sarcoidosis, patients often present to dermatology for initial diagnosis. We wanted to evaluate the racial differences in systemic involvement among patients initially presenting to dermatology with cutaneous sarcoidosis. And how we did this is through identifying cases of cutaneous sarcoid at Mass General Brigham. We identified 50 cases that did not have previously established systemic disease, and then examined whether workup revealed systemic disease.
We found that of the 50 patients diagnosed with cutaneous sarcoidosis, 78% of Black patients had systemic involvement compared to 46% of non-Black patients. The difference between these two values was statistically significant. 33.3% of Black patients had disease in one extracutaneous organ and 44.4% had disease in 2 or more organs. This is in direct comparison to 12.2% of non-Black patients who were found to have disease in one extracutaneous organ and 34.1% showing disease in 2 or more organ systems. Additionally, if we focus on cardiovascular involvement, none of the non-Black patients had cardiovascular involvement, whereas 29% of Black patients had cardiovascular involvement. In summary, Black patients who initially presented with cutaneous sarcoidosis were more likely to be diagnosed with systemic disease than non-Black patients. Additionally, Black patients were more likely to have 2 or more organ manifestations compared to non-Black patients. Lastly, Black patients also exhibited higher rates of cardiovascular organ involvement, which is associated with worse prognosis. Our study suggests that there may be substantial variations in organ involvement between racial groups of patients presenting with cutaneous sarcoidosis.